Hi, it's Paul. This is another unknown respiratory case. It's a series of 3 sputum, and it was from a patient with clinical notes saying cough with dark sputum. And macroscopically, all 3 of the specimens did appear to have sort of dark brownish flecks through them. They all had a fairly similar appearance, so I'm just going to show you a bit of a compilation. See what you make of it. So what do you think? Are you thinking what I'm thinking? The specimen was highly cellular. It had a background of some squamous epithelial cells, and there was even scattered bronchial epithelial cells around the place. But most of the cells present were in these sort of loose groups and arranged in an isolated fashion. On low power, they got a bit of a kind of macrophagey look, and the specimen had a sort of dirty look. There's certainly quite a bit of pigment around. These cells, low power, size, shape, and NC ratio really of pulmonary macrophages. There were some groups, but they are more kind of loose collections of cells than showing any organisation. On high power, the cells really looked fairly plasmacytoid. They had round, eccentrically placed nuclei and a sort of moderately increased NC ratio. The cytoplasm was fairly granular, and there was definitely quite a bit of pigmentation around, so it was a bit of extracellular pigment, and then the cells seem to vary in terms of their pigment load from being quite finely granular with it through to those where it obscured the morphology. Nuclei were round and had fairly fine chromatin and prominent nucleoli in all of the cells, mostly sort of single central, a few multiple ones around, and binucleation and some multinucleation as well were a real feature of the specimen. So I hope you agree this looks pretty classic for metastatic melanoma, really. It could almost be a lymph node FNA. Looking into the history, the patient had a previous melanoma excised from the back. We made a cell block, and as you can see, it was nice morphology, large malignant cells, some of them showing pigmentation. We performed immunos on this, and the cells were positive for SOX10, melon A, and negative for cytokeratins, considered to be consistent with metastatic melanoma. So I hope you enjoyed that case. Thanks for watching.